Good evening and welcome to tonight's public hearing. This hearing will include Columbus City Council's Health and Human Services, Finance, and Workforce Development Committees. I'm Councilmember Priscilla Tyson, President Pro Tem of Columbus City Council and Chair of the committees. Before we begin, please be aware that this hearing is being recorded for rebroadcast on CTV, the Columbus Government Television Channel 3. The rebroadcast schedule is available at www.columbus.gov. Tonight's hearing is one in a series of bi-weekly committee hearings that I hold in order to review legislation in the committees that I chair. This includes Health and Human Services, Finance, and the Workforce Development Committees. The goal of the hearings is to promote transparency and provide an opportunity for city residents to learn and speak on legislation that impacts their lives. There will be on occasions when a committee is not covered because legislation is not always scheduled for each committee. The intent of each hearing is to review legislation that will be on City Council's agenda for the following 2 weeks. Tonight we will hear information on legislation in the Health and Human Services and Finance committees. Presenters this evening include from the Department of Finance and Management, Christopher Long, the Fiscal Manager, and from Columbus Public Health, Dr. Teresa Long, our Health Commissioner. I will begin with legislation in the Finance Committee by asking Christopher Long to present. Good evening, Christopher.
Good afternoon, President Pro Tem Tyson. This afternoon, we only have one ordinance for your consideration for the April 3rd council meeting. It's ordinance 0682-2017, and this seeks authorization for the Finance and Management Director to modify an existing UTC contract with an entity called Badger Meter Incorporated. Essentially, it's seeking authority to add a couple of water meters, a couple of items to that UTC. The existing vendor that was supplying those items, what they were supplying wasn't sufficient. It wasn't a quality product for the city of Columbus and utilization. So we're seeking authority to award those to another vendor.
Thank you. And those specific issues and that the vendor, the current vendor that we've been using, that particular vendor, this new vendor will not have those same issues or concerns?
That's correct. They were deficient water meters that were discovered by purchasing and the Division of Water, and we've asked for a rebate from the previous vendor for those monies spent, and then seeking authority to award to the new vendor so we don't have those quality control issues.
This is a quick question. So how did you find out? How did we find out that there were issues with those meters?
My understanding was that the Division of Water notified the purchasing office that these water meters weren't operating as originally intended. I think through sort of routine maintenance and upkeep and checking on the water meters that were installed. And then after that, the purchasing office became involved and saw that this was more than just a singular issue. It was widespread over multiple products over many months period of time. So it was more than just a single issue.
I'm just asking, were these meters that were on our buildings, meters that we had put on our buildings, or not?
I'll have to check on that, President Pro Tem Tyson. I'm not sure if they were just on ours or on city residents' locations, but I can find that out and get back with you.
Thank you. That will be helpful so that just if you could provide us with that information. I'm glad that we resolved this issue. We're now going to have new meters. And again, if you can just get back with me on, who had these meters and things of that nature. Okay? Thank you. Thank you very much.
Thank you.
All right. Dr. Long, the floor is yours.
Good evening, Council President Pro Tem Tyson. And I just wanted to make a disclaimer that Christopher Long is not my brother, cousin, etc. We just came from an ethics meeting, and I wanted to be sure that there's no nepotism, no family connection. Actually, I haven't even found where Chris's family's from, so someday we'll do that. So we have 5 items for your consideration tonight, Councilmember Tyson, and in 2 of the cases, there are actually connected items. So let me start with the ordinance number 0729-2017, which is the Immunization Action Plan Grant Program. And this is a grant that we are being awarded to Columbus Public Health by the Ohio Department of Health. It's actually an ongoing grant. We would ask for your consideration and hopefully council's acceptance to accept and appropriate $592,185 to fund this action plan from April 1st, 2017 through June 30th, 2018. So it's a little bit longer period than we often have. And actually this IAP project, we've had it for many years. It is actually changing this year. And this year, while it still is all about the ultimate goal of trying to get children under the age of 2 90% immunized in our community, the state has changed their payment system. So they will only pay for the deliverables, which in this case are the achievement of their goal areas. And so it's a little bit different. I can tell you that my colleagues at Columbus Public Health, we will have a subcontract with Franklin County Public Health. It's slightly different this year. We've not done that before. But all the other metropolitan health commissioners are very concerned about these deliverables because actually they're very hard to achieve. So let me share just a little bit about those. So again, the focus is broadly is about children who are not immunized, and yes, about underserved populations, uninsured, and racial and minority populations as well. Actually, we have done very well in this community over years past and actually have immunized many. 38% of the people we see are uninsured. However, the deliverables really have a lot to do with private immunization providers or private physician practices. So multiple of the deliverables actually require staff, public health staff, to go into providers' offices to make assessments, to tell them what they're doing well, but more so tell them what they're doing not so well and get them to change their practice. And also to get them to sign up to be a part of the statewide immunization registry. Actually, none of the deliverables have to do with giving shots to children. So again, we are committed to this work. We think it's very important. Many children are immunized. The majority of children are immunized in provider practices. But if the provider doesn't want to let someone from their public health agency in, that's true both in Columbus and Franklin County and all across our state, it is very hard to achieve these deliverables. And what that will mean then is that we would not be drawing down that full amount of the $592,000. We have talked to the state about changing the approach, but so far we haven't gotten a lot of positive support or interest in that. And I understand this is really what they feel they need to achieve. The reality is it may mean that these funds don't go fully spent, and unfortunately, that does not actually achieve the goal of 90% of young children being immunized. But that indeed is the situation.
So Dr. Long, in Columbus or Franklin County, since the goal was 90% of children, what is the percentage right now?
Yeah, that's a great question. Well, the Centers for Disease Control, which used to do an annual survey, stopped doing that about 10 years ago. So it is very hard to know. We can tell you from look-back studies from kindergarten, where we actually send our own staff in to look at how well immunized were children across the community at the age of 2. By the time they get to kindergarten, we can go back and look. And in some areas we do very well, but in some areas we do very poorly. So I would guess today that the average immunization rate probably across Columbus and maybe well across Franklin County is probably in the 65% range. We have known that we have some areas that it's down as low as 40%, and then we would imagine that there are some that are 70, 75, even 80%. So we have a lot of room to go, and that's actually said from someone who's very proud that this community was the #1 city in America for having our children at the age of 2 immunized. And we actually had much higher immunization rates, but the reality is the immunization schedule has changed. It's gotten more complicated. Our providers may not be as good as well as all of us at getting all of our young children. So this is something that new infants are being born every day, and we cannot let up on the kind of important work it is to work with parents and with providers to see that children are fully immunized.
Thank you, Dr. Long. I'm just reading what basically the services that you have to provide to be able to receive these dollars. I mean, it requires a lot of human resources.
Correct.
To be able to get this work done. And then again, you see the partnership with the pediatric and family practices. I mean, having teen immunization summits and conducting ongoing self-assessment and quality improvement plan to ensure best practices are implemented, robust reminders. And so the reality is, be great to get the entire amount, but these are some pretty hefty goals.
Correct. We're going to do our best. We want every penny to come to this community, as you know.
I'm sure that we do. And so obviously, I think the education part of this is so important as to the importance of immunizations. And so hopefully that there has to also be continue to be a robust education component as the people understand why this is so important. And we certainly know there are certain people who have different views of immunizations, but certainly.
Well, honestly, we completely agree with that, but we have pushed our state, and actually I was chatting with one of your colleagues here, Mr. Michael Kasler, about our state health department. We have pushed back and said it would really be helpful to achieve these deliverables if the state would mandate that the local health jurisdiction has to come into their practice to do this kind of work. They have refused to do that. So nonetheless, we have worked very hard and we have good relationships with many providers, but indeed this is not easy work, and we know it takes them away from their primary focus, was just seeing the young children and families, on a routine basis. We think it makes their practice better. Many are appreciative. Almost all are appreciative once we actually get in, but we recognize that we will likely not be 100% successful in achieving all the deliverables.
Thank you very much. Okay.
So the next item is clearly related to it. It's entitled the Franklin County Public Health IAP Deliverable Services. It's Ordinance 0731-2017, and this would enable the Board of Health to turn around and contract for these same services with Franklin County Public Health. And they would then do the same kind of work with practices that are actually in the non-Columbus and Worthington jurisdictions. So the amount of funds available to contract with them are $74,981, and the same time frame from April 1st, 2017 through June 30th, 2018.
Thank you.
So then on to the next item, which is Ordinance 0747-2017, entitled HIV Prevention Grant Program Additional Funds. So that's the good news. The good news is that we have been awarded additional funds from the Ohio Department of Health from there and for our federal HIV prevention grant program of $80,000. They have asked us if we would be willing to work with them on our integrated HIV prevention and care plan. And as you will see in the next item, it really is almost all of it going to go back out in a contract for a public awareness campaign around PrEP, which is the pre-exposure prophylaxis initiative, the once-a-day pill that actually reduces the risk of persons who are not infected with HIV but have high-risk behavior from, again, being the potential for them to become infected with HIV. So we're very excited about the opportunity to work with the next contract, which is the next item, but to move forward a broader and a more, I don't know if I'd call it ongoing because these funds have to be spent pretty quickly, but a campaign around PrEP. And actually we'll be working with our partners, I know you know them, Equitas Health on this. They actually have received an additional grant fund from the state to also work on this project.
So Dr. Long, on the initial legislation is 0747-2017. So this will be the first time we're getting these dollars, and it will be for, is it from 2017 through 2021? Is this the first?
Yes, it's an ongoing. That's how the state grant is entitled. That's why the name of it is there. But these funds actually need to be spent very quickly. And
by June 30th?
By June 30th of 2017. And that actually takes me to the next item, which it does have that June, and I apologize, it's not in your background information on the first ordinance, but in the second ordinance, the 0749-2017, the PrEP media campaign with the vendor Spots and Dots. This actually does speak to the time frame. So we had actually been given some monies. This is now additional monies, and I'll come back to that. But the total amount for this public awareness campaign is not to exceed $75,000. So this is the project around PrEP, and actually we had anticipated and already had a relationship for a $40,000 amount. So this actually allows us to increase the amount. So we would request that rather than having to go out and rebid the whole thing, which again, to be able to spend the money and have it occur by June 30th would probably be very unlikely, that, again, we would not go out for a rebid, that this would basically just be acknowledged as a late award of these supplemental grant funds to take us to the total of $75,000 to be able to, again, move forward this HIV prevention project around PrEP and, again, the pre-exposure prophylaxis initiative.
And Dr. Long, certainly, yes, I'm glad that we are certainly, again, I know we wouldn't have the PrEP press conference, and certainly how important PrEP is to, as you mentioned, to individuals who don't have HIV or AIDS, but are also, we could have partners that could possibly have HIV or AIDS, and this would prevent them from contracting that illness. So can you talk to me just a little bit about the media campaign around this?
Well, I would love to talk to you a lot about the media campaign. I can't tell you too much about it. I know that we have been working, my colleague Jose Rodriguez, along with someone connected to Equitas Health, have been working and thinking about this kind of a campaign for a while. It's definitely going, it's not very large, obviously, it's $75,000. So it's definitely targeted to those who are high-risk individuals, both those who we know are partners of persons already with HIV, or those who may be in risky or potentially higher risk situations. So again, that could be men who have sex with men, men who have sex with men who are in minority relationships, et cetera, because we have certain populations we're most concerned about, and I believe it will be focused through some of the specific outreach initiatives there. So some of it will likely be social media, but there may be others as well. And of course, if you would like more information, I'd certainly be happy to have Jose get that to you.
Well, certainly, as this campaign continues to move forward, any way that we could be, helpful in terms of sharing information from council, we certainly want to be able to do that. As we know that Minority Health Month is coming up.
Yes, we do.
April 1st, that one of the areas that we're certainly concerned about, and that obviously the event you had at Columbus Public Health around addiction in the African American community, but certainly HIV and AIDS, how the numbers continue to increase in the African American community. And so it is important that we're making this information certainly available to people of color, because the numbers just, keep going higher and higher. So
correct. Thank you, and we look forward to working with you and sharing as this moves forward.
Thank you, Dr. Long.
And then the final item, Council President Pro Tem Tyson, is actually something that I know is near and dear to your heart. I only wish it was a larger sum of money, but the Ordinance 0769-2017 is to accept and appropriate the large amount of $4,000 from the Greater Columbus Arts Council to support our 2017 art walks. As you know well, we take a very small amount of money and couple it with a lot of commitment on our staff's part, but we will be, with these funds, and obviously it'll take more than that, but be updating, designing, developing, and printing all the information around our 14 existing art walk maps. We'll also host 18 guided walks, art walks, in each of the Columbus Art Walk districts, and of course continue to promote the public engagement about the importance of walking. And of course, art walks, as you know, you have walked with us, is all about highlighting public art, architecture, and historical sites, but mostly about getting our Columbus residents and visitors out and active and exploring 14 exciting neighborhoods and aspects of our community. And for us, it is all about people having the experience of getting outside and taking a walk, which we hope that they would do more often than even 14 times in our summer. But nonetheless, we really love to get people out and walking.
Thank you, Dr. Long. And so this is going to be the 5th season of
Yes.
the Columbus Arts and Art Walks and Landmark Talks program. And if someone from the viewing or listening audience would like to participate in these walks, how could they do that?
So they could always Google columbus.gov and art walks, but they also could call my colleague Scott Ulrich, who connects us on all of that, and his number is 614-645-5318, or his email address is I think I have it here, yes, STUlrich, UHLRICH at columbus.gov for more information. But again, I think if you just Google Art Walks Columbus, I think we will pop up. And it could either come up under us or under the Landmarks Foundation, because we do this in partnership with Columbus Landmarks.
Well, thank you. I look forward to them. I know that most of the time they're on Mondays.
I know.
And we also, most of us in this room have other engagements on Mondays during that time. But certainly the days that we're not in council, I certainly like to come out and walk. I think it's just a great program, and it allows you to meet other residents from our community and maybe from other communities that come to our city, but also just to learn the history of many of the beautiful buildings in our city, but also to be able to see the art that's within our neighborhood. So hopefully, if you're the viewing and listening audience, please take advantage of this amazing program through Columbus Public Health. So with that,
That's it.
thank you, Dr. Long. All right, so with that, I think that will conclude this hearing for this evening. And certainly, I hope that this evening's hearing has provided insight into the programs and community initiatives from Columbus Public Health, as well as finance-related legislation that is necessary to support our ongoing city operations. As residents, these hearings are, again, an opportunity for you to learn and become engaged in issues that have been presented. Before concluding tonight's hearing, I want to thank, from the Department of Finance and Management, Christopher Long, our fiscal manager; from Columbus Public Health, Dr. Teresa Long, our wonderful health commissioner; Michael Kessler, who leads our legislative research office; Matt Erickson, who staffs the finance committee; Aaron Beck, who staffs Health and Human Services; Nancy Sully from the Council's Community Engagement Division; then my staff, Nicole Harper and Carl Williams; and then the hardworking staff of CTV who make these hearings possible; and finally, the residents who allow all of us that's here tonight. And I just mentioned, we're so thankful that you allow us to work for you and to help us make our city the best place to live, work, and to raise a family. And thank you. This hearing is adjourned. And go out and enjoy this beautiful weather. Thank you.